In 1347, the port city of Messina sat at the center of a growing global trade network. Massive merchant ships arrived daily from distant lands, unloading heavy crates of silk, spices, and gold into the crowded harbor. But the most significant cargo was hidden below the wooden decks. As seen in this image, the common flea was so small and translucent that it remained entirely invisible to the people on the docks. These fleas were carriers for a specific biological payload, Yersinia pestis. These colorful clusters in the scanning electron micrograph are the bacteria cells that would soon dismantle the city's population. Humanity had spent centuries perfecting trade routes to move goods across the world. Without realizing it, they had built a highly efficient delivery system for an enemy they couldn't even see. When the ships finally docked, the physical symptoms were immediate. Sailors staggered onto the pier with blood leaking from their mouths and large black swellings covering their necks. Despite the visible sickness, the merchant leaders refused to turn the ships away. They gave the order to unload the cargo immediately, ensuring the silk and spices reached the market before the harbor could be closed. The plague entered Europe through this specific human decision. The leaders stood on the docks, looked at the dying sailors, and chose to keep the gates open to protect the value of their ships. Inside the walls, the disease thrived in dense medieval cities. Lacking sanitation, residents dumped raw sewage directly into narrow alleyways. This waste caused the rat population to explode. Rats moved directly indoors, bringing infected fleas into constant contact with families. Centuries of dense organic city growth and a total lack of waste management had created the perfect conditions for a biological catastrophe. The speed of the infection created immediate panic. Families who appeared healthy at dinner would wake up to find their children dead by morning, with the survivors already coughing blood. As the death toll rose, social order dissolved. Neighbors abandoned one another, and some even locked their own sick relatives inside their homes to die alone, while the city turned to witch hunts and violence against outsiders. Thousands of people fled the infected cities in terror, rushing into the countryside to escape the smell of death. These people unknowingly acted as carriers. By running away, they brought the bacteria to previously untouched villages, ensuring the plague reached the farthest corners of the continent. Not everyone ran. Groups of nuns, gravediggers, and local doctors stayed behind, working day and night to care for the dying and bury the thousands of bodies piling up in the streets. Their medical tools were primitive. Many doctors wore bird-like masks filled with dried flowers and herbs, believing that the scent would block the bad air they thought was responsible for the sickness. Because they had no concept of microscopic bacteria, these efforts were doomed. Even the most dedicated caregivers eventually became infected, falling victim to the very patients they were trying to save. When the first wave passed, 1/3 of Europe's population was gone. Entire villages were left completely empty, with abandoned homes rotting in the wind. This mass death created an immediate labor shortage. There were no longer enough peasants to farm the lands. Surviving workers realized their value, demanding wages and challenging the kings and landlords who owned their labor. The loss of life had stripped the elite of their leverage. The survivors were able to use their scarcity to force a change in the social order, moving wealth and power away from the crown and into the hands of the working class. To prevent another disaster, the survivors changed how they lived. Ports began enforcing 40-day isolation periods for incoming ships, and cities started building the first organized systems for waste removal and public sanitation. There was also a shift in how people viewed the world. They moved away from purely supernatural explanations for disease and began using empirical observation to track how sickness actually moved through a population. This early focus on public health led directly to the systems we use today. The modern hospital is the result of centuries of learning how to isolate threats and provide organized care. Today, we have replaced superstition with data. As seen in this laboratory, our defense against disease is built on the rigorous study of the microscopic world. The events of 1347 show that even the most complex global networks are vulnerable to a microscopic enemy. Our only protection is a commitment to the scientific inquiry and public health system.